Thank you for joining us at NRCC TV. It is another episode brought to you by the Netherlands and Romanian Chamber of Commerce. At NRCC, we zoom in another interesting and great topic about related news and about viewed from various perspectives. Also, today we dive into redefining health and well-being at NRCC members, and we talk with NN Asigurări de Viață, Philips Healthcare, Regina Maria Dental Clinics, and Telios Care. The concept of health care and well-being is very important and constantly evolving with the World Health Organization combining the two. And it's important, it is very important to talk about independent and interdependent healthcare system. And I will quote right now, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And the guests and the speakers who are next to me today are Oana Dima, Lead Value Proposition Manager at NN Asigurări de Viață, Şerban Isopescu, Health System Leader of Philips Healthcare, Ionuț, Leahu, CEO and dentist with competence in oral implantology at Regina Maria Dental Clinics, and Ciprian Bujor, Deputy CEO Telios Care. Oana, what are the main perceptions, people's perception when we talk about health and well-being?
For this perception topic, we actually have some very interesting findings from a study we had done in NN Group in Romania and in other countries. One interesting finding is that 1 in 2 Romanians think that it's likely for them to live up to 90. So I would say it's quite an optimistic outlook. But this outlook actually requires some focus on some areas: health, well-being, financial security, and so on. There is a sort of reality check. 7 in 10 respondents believe that they actually need to do something to improve their lifestyle and to focus on elements, areas of health, both physical but also mental, emotional, and not to forget stress management. So there is also another element that appeared in this study, which is about not only the length of the life, but also the quality of the life. So longevity is not only about living longer, but also living better. And for this, it's quite important to secure financially the future. So this is another element. And again, if we go back to optimism, we asked people, and how prepared are you for this? And they said 3 out of 4, we are prepared for this. But when we look to the actual solutions that people have to secure financially their future, it's only 26%. So I would say perception is good, there is optimism, but actions are still to be made.
NN is the leader of the life insurance and private pensions market in Romania, and it's very important to understand in the same time and correlated to what NN is doing right now. What are the main concerns of the people when we talk about health and well-being?
It's not only optimism. From the same study, actually, we have seen also concerns, because it's only 58% of people are confident that when they would face a medical situation, they would find a solution. More than this, more than half of these believe that this situation will put a significant burden on the family budget. On the other hand, another study, recent study from 2023, showed, actually that was the main scope of the study, to rank the concerns of people, both Romania and worldwide, in regard to health. And in Romania, we have quite a specific situation. We have a clear number 1, unfortunately, in terms of concerns, which is cancer. 1 in 2 Romanians have a very profound concern on what would they do if they would face a cancer diagnosis, versus the global situation, which is 1 in 3. So it's quite a significant difference between the Romania and worldwide. If we look to the second ranked, it's heart conditions. Which again, it's typical for Romania, because worldwide it's ranking only 9th. Plus, the weight is quite significant, so ranked second and with a weight that is similar to number one at global level. So this kind of diseases, cancer, heart condition, if we extend, there is also neurosurgery and so on. These are top concerns of Romanian when it comes to health. And it's not just a concern, it's actually fueled by the statistics, the reality. The incidence in Romania is big. 4 in 5 Romanians have a close acquaintance that is facing this diagnosis. But still, there is an important thing to say about this incidence. In Romania, actually, cancer incidence is lower than European average. But if we look to mortality, we are 7% higher than European, which means there are some actions to be done, and we have looked in order to somehow identify where can we put some actions. And the World Health Organization is actually pinpointing early diagnosis as one key driver to improve significantly the success rate of a treatment for critical illness, especially for cancer. Besides this, there are two other concerns about how rapid can the patient have access to a very specialized treatment. And last but not least is the financial burden, because it's not just a concern of what should I do, it's also of how can I support this financially. So these, I would say, are the main concerns in terms of health.
Very interesting. We will develop more a little bit later. I want to talk now about technology, and Philips is a healthcare technology company focused on improving people's life through meaningful innovation, from a healthy lifestyle and prevention to diagnosis, treatment and home care. And now, Şerban, because we talk about the national health system, it is a strategy that we need to implement, I believe that in the next 5-6 years maximum, and aims at modernizing and having technology much more present in doctor's life and also in patient's life. It is possible to have a good strategy without technology, implementing technology in the health strategy national system, of course.
I would start, Teodora, by mentioning the fact that the hospital in Romania is a very critical pillar, and it should belong to the people, to the citizens. The healthcare system in Romania should shift from a system to a patient experience. The national healthcare strategy in healthcare, which is called Together for Health, it's actually having in plan to build a new type of healthcare system in Romania, in which the patient is in center. The new healthcare system should be a very intelligent system, resilient, and also fair, in the sense that each patient should have access to this healthcare system, and doesn't matter the income level, doesn't matter the geographical location of the patient, and also the social status. The healthcare system, in order to be sustainable, intelligent, has also to be sustainable, right? And sustainability in healthcare, it's also seen as an end-to-end process, from planning, procurement, funding, taking into account the whole ecosystem, the environment, because it's not about patient, hospitals and authorities, it's also about private healthcare, which is also a complementary component in the whole system. It's about financing, it's about private insurance for healthcare, and all this should be considered in this healthcare strategy. If we talk about sustainability, authorities should also consider, when investing in public procurement, in technology, not only the initial investment. They should see also the future trends. Future trends are actually future needs. And in a healthcare system, once you have big data information about your citizens, about the health status of your citizens, you can actually forecast the needs in the future. As my colleague said, we can foresee special need for cancer diseases, cancer-related diseases, cardiovascular diseases, and in such a way we can invest right in those segments. And investment is not only medical technology, investment is also education. Healthcare professionals, prevention, all these are coming together.
Telemedicine is very important, and I want to say a little bit more about Telios Care. Is the first telemedicine medical clinic in Romania dedicated to making healthcare more accessible and, in the same time, more efficient. And Ciprian, I think it's important to understand how can telemedicine improve the medical system, also public and private sector, and if can be expand to a national and to see it at a very national health public system in Romania in the next, I don't know, maybe the same 5 or 6 years?
When we say telemedicine, we think it's something innovative. Actually, the way we do it, it's innovative. Like you use digital means right now to make.
Because it's not something new.
It's not something new. It's like one of the first discussion on the telephone was about medical conditions. So somebody thought about using a telephone to have some medical advice. So and I remember when I was a little child, my grandparents were working in the medical field, and they had a phone where somebody was calling and they were giving advice at night or something like that, or if necessary they were going to visit the family. So it's not really new, but in the way you do it right now, it's new, and also the conditions somehow change, and the behavior of the clients or the users change a lot, especially after the pandemic. Or the pandemic was a trigger to make people more aware of the way you should access medical services, and also they saw that the barriers they had before could now be overpassed by using telemedicine or some digital form.
But it's a good thing that...
it's a good thing, yeah. It was an educative, it was like a positive part of the pandemic, the only one, I think. Mm-hmm. So what we are trying to do is to bring here in Romania, what we tried and we succeeded was to bring here like 25 years of experience from United States, where the market is much more mature. We try to bring some definitive differentiators from what was happening already here in this field of accessing medical services from a distance, and also we try to respond to some specific needs. For example, I read a study where Romanians are saying that more than 40% of them postpone the visit to a medic because of different motives, like too much time spent in traffic, they didn't find the right doctor at the right moment, they thought it's an emergency, but at the same time they postponed it a little bit and then they found out it wasn't an emergency, or money, it's expensive. And telemedicine can help here because on average a visit to a doctor will cost you maybe in Romania around 300 lei, 400 lei, and not everybody will afford that. Of course, if you go to a private clinic, but if you go to the state, maybe you'll have other factors that will make a problem for you.
Time spent, yes.
Time, whatever, you don't know where the doctor can be found. Maybe you'll spend too much time waiting for that, and you don't want to, you are pressed to find an answer. Maybe your employer will not give you time to go there or something like that. So if I go back to the cost, on telemedicine, the cost will be at least half of that. So if you're an individual, but if your subscription is paid by your employer or maybe by an insurer, you already have an insurance maybe through your employer, then it's much easier to access the services. And 82% of the cases we serve don't need an in-person visit to a medical clinic. So we help also the insurer, we help the client or the user, and
it's also useful for the doctors.
Yeah, also for the doctors, because they will not be pressed with people waiting outside, and they will not have to fill in more patients in a 1 hour, let's say. So yeah, this is what telemedicine can do and what we are trying to do. And in the future, I think the pressure will become much more visible on the medical system and also on those who try to access the services of medical services, because there are some global factors which will also affect us in Romania. For example, since 1974 until now, each 12 years, the world population grew with 1 billion people. Of course, this trend will not continue. We'll reach in 2030 maybe 9 billion, but also the level of life, of income grows. And as the level of income grows, the birth rate declines. But in the same time, people are living longer. And this is a good thing, right? But at the same time, if you live longer, you put more pressure on the pension side of the system and also on the medical side of the system. You cannot keep your health for longer. At some point, you'll have some problems. And even if you don't have problems, you'll need to access services because you want to be preemptive and you want to know if something can happen to you, and that also it's good for everybody. And this was done, for example, in Japan 60 years ago. In Japan, the average lifespan was 60 years old. Now it's 85. It's 85. What they changed was that they made one visit per year mandatory to everybody. So they need to go and check themselves, even if you are 20 years old, 30 years old, whatever age you are, you have to go to the doctor and check yourself at least once. And this preemptive measures made the population live longer, healthier, reduce a little bit the pressure on the system, maybe on the insurance system, but also put some pressure on the medical system. So you need a solution to help these people have preemptive behavior. And how can you do that? Because you have a limited time in the clinic, you have a limited time in a day, right? You have a limited number of doctors, so you can help them through telemedicine, for example. Sure. This is the answer, I think.
Yes, I want to talk now a little bit more about stomatology because it's a very important part of well-being, and Regina Maria Dental Clinics is the most extensive dental work in Romania with a balanced national presence in 13 cities and a team of 500 persons and 170 doctors. Ionuț, Leahu, why it's so important when we say about stomatology? It's a big part, and I think it's one of the most important part in health and in well-being, because the care of our of our mouth is very important for the whole body, for the whole immune system.
Yeah, what's different about dentistry compared to other medical specialties is that at the dentist we are all patients through our entire life. So we get patients that are a few days old that need a little intervention under the tongue because they cannot feed themselves, they cannot grow as a child. And of course, once the first teeth appear, the first issues may appear. And of course, we struggle to go to the preventive side, and we are really proud to grow the future generations that will have fewer problems.
A holistic
approach.
Therapy.
And what's happening, of course, through the entire patient's life, they get other problems. And there are a lot of studies that show the link between problems like period disease, where you have inflamed gums and bleeding in your gums, and because you get a permanent state of low inflammatory disease, basically, it will interact with your diabetes, with your cardiac health, because we are talking about cardiovascular disease. And this
cancer, because
with cancer, the issue with oral cancer is that, of course, you can treat it, but you can survive it. But the way you have to live after oral cancer, it's not such a good life afterwards, because surgery, where can you cut and you won't be affected? No?
And the bones are affected in your mouth, and it's very complicated.
Yeah, so we've done a lot of studies about that, and that's why we're really happy that we are integrated now in the biggest player in integrative medicine, because we have access to the patient's file. So we basically do at a smaller scale what I think it should happen in Romania with the whole medical system. We have access to the digital patient's file. So it's one digital file for every patient, and we can see the whole history inside Regina Maria. So also the patient has access to
not
the
only
data.
on stomatology, on everything.
On everything.
That's why I'm saying holistic approach.
On everything.
Yes.
So that's why imagine that now we have in our database 7 million people in Regina Maria. So the chances that you already visited, I don't know, you had blood work done or other consults, or you have a subscription to Regina Maria, and then when you come to the dentist, we have access to all that data, so we can, of course, we always ask the patient, how's your general health? But now we know. So now we know
the reality.
Because patients sometimes forget or believe, hey, I'm at the dentist. I shouldn't tell the dentist about my osteoporosis treatment or about my anticoagulant treatment or some things like that, because people tend to think that old school style. I mean, the dentist only drills and fills.
And it hurts.
You're talking about your personal experience.
I think it's our own experience, yes. Yeah, so it's a holistic approach, and I think this means that we have to understand that going to, not only to dentists, it's important to understand that it's for our health and about our body and mind and soul and quality of life.
Yeah, we are talking about putting the patient in the center of our care. But
exactly.
To be able to do that, you need first of all to look at the person as a doctor, and then you need to look at the pathology or the organ or the side of the body that you treat. So even if we cover only the mouth, we always talk with the patient and try to understand what else is going on there, because this holistic approach, this is what we managed to complete in Regina Maria. That's why we are now talking a lot about One Health, because it's not the health of the mouth, the health of the heart, the health of your legs or your mind. Everything is linked. And we always find the link. For example, we treat a lot, and me personally as a doctor, I treat a lot of elderly women. And they come in a severe state of depression because they lost their teeth, and they receive the removable prosthesis, and it never fits, and they don't like how it looks, how it feels, and then they stop going out. And if we talk about longevity and quality of life, the Harvard study that has 85 years of data shows clearly that if you want to live better and longer and have a fulfilling life, it's also about relationships that you entertain. And without feeling okay in your body, you cannot do that. You don't want to see anyone. And sometimes they are brought by their children, you know, and this week especially, I've done surgeries to mothers of our colleagues. And, you know, I can see the changes that they go through. And this is the most satisfying thing for me as a doctor, when I see after the patient after 1 year, after 5 years, after 7 years, and I understand what a huge impact has just having teeth, you know, something that we all have here. We are lucky to still have our own
able
teeth.
To smile.
We take them for granted, but some of us are not so lucky. And eventually, this is one other fact. If we are going to live long enough, we are all going to lose our teeth.
Yeah.
So,
It's a promise.
It's a promise.
Okay.
Guarantee. So that's why we need to keep in touch.
But we have options, no? We have options.
Yeah, we have options.
We're not going to be without toothless.
Yeah, and
Only one.
all in one. Yeah, the good news is that we had time to practice. We had time to practice for the last 15 years.
For us.
We had time to practice as doctors. We treated tens of thousands of patients that we do a special kind of surgery. So for end-of-life teeth, not a patient, end-of-life teeth, we do everything in one surgery. So we replace everything in one surgery, and the next day the patient
Not removable. It's
fixed teeth.
Fixed, yes.
Fixed teeth. So this is, the best approach if you are in that kind of a situation.
Okay, but Oana, as Ionuț Leahu said, there are some barriers. People face some barriers when we talk about accessing healthcare system. What are, I don't know, maybe first 3 or 5 barriers, or I don't know, what happens in their mind?
I will point one significant barrier, which we call in our industry protection gap. So it's about money to access the options that are starting to appear on the market. So it's not about necessarily about a treatment and medical option being available, but it's most of the time about the possibility, financial possibility to access it. This is what we call in, as I said, as our industry protection gap. because usually people go to a public system for medical care, but for some specific conditions, medical condition, they would like to access a doctor, for various reasons.
1%, the public sector is 1% of the dentistry market.
Exactly. There are cases either specific for some medical specialties or to some conditions where people actually what they would like is to have an alternative to access for their specific condition. Either Romania or abroad, which implies quite a high cost, sometimes significant cost, that it's not easily easy to bear in a family. There is an estimation done by Munsar which says that on average in a family to go through an unforeseen medical condition, a family would require, it's an average, 132,000 lei for, as I said, average including some serious conditions. On top of the already available budget in the family in order not to affect significantly the standard of living in that family, which we may easily understand that is not kind of available for all the families in Romania. Actually, a big chunk of the families in Romania are what we call financially vulnerable. So even a smaller than this amount a smaller situation would actually put a significant burden on that family, and not to mention
it's impossible
impacting.
For most of them.
To pass through it. This is what we call, and I will just stop to this one big barrier, which is financial possibility. It has a name, it has a lot of plans in behind in the industry and so on, in order to somehow put alternatives, financial solutions for the people to overcome this burden when they face a medical situation.
But what are the solutions to reduce this gap, if it's possible on short term and of course on long term, because it's not something so easy to achieve?
Yeah, this is what we do in our industry. It's just offering a financial protection, a solution in order to ease basically the impact, the financial impact in case a medical situation appears. It's just, I would say, something that this is what we do for a living in our industry. There are various solutions on the table, various measures. What I think is important, and again I will stick to one thing, it's about the low penetration. It starts from the education, understanding that this is a solution, understanding how does this help. And it's not only with an end, but with the entire industry to make insurance, to bring insurance closer to Romanians. Irrespective who managed to get there first, of course we do our best to be there first, but it's important to push this because we are, there are two elements. This protection gap is significantly bigger in Romania versus other markets, and it's linked to our behavior in saving and so on, education and so on. So protection gap is bigger, and penetration of insurance, which is a solution, is significantly lower. So basically from both ends, it's quite an open area where the entire industry, I think, we see needs to put a lot of effort to push it, as I said, closer to Romanians. Any types of measure, any kind of insurance, health or life, because also not to mention a death case in the family puts an even higher burden. So it's important, I think, for us as an industry to bring this topic closer to Romanians, because this is actually a solution at hand. Saving is one thing, but looking to the cost, because medicine is advancing, but it comes with a cost. So it's not easily for a large segment of population actually to manage to access this in case of medical necessity just from saving. So, as I said, this is what we do day to day, and there is still a big room to come closer to a decent level, I would say, of Romanians being having a solution whatsoever.
Şerban, because we are in a big trend of technology, what are your best practices when we talk about modernization of the health system in Romania so far?
Listening to Dr. Leahu and also to Oana's comments, it's very clear that Romanian patients start to have options, alternatives, in the good sense, in the positive sense, but also we see the concern about the cost. Yeah? Technology, it's somewhere in between. And we can discuss about telemedicine, but we should also discuss about other technology solutions. I see Romania as a big disconnected group of islands type of structure, yeah? Because we have Regina Maria, for example, which is a very strong IT system. We have other private players in the market with potentially similar levels of IT infrastructure. We see a lot of information also in the public system, but any Romanian patient moving from this island to another island is losing the data. That's why a basic layer for information should be to have an electronic patient file type of system in Romania, to have an IT model at the country level.
A national system
absolutely.
accessible for everyone.
Yeah, and this is not only helping the patient, it's also helping the country, the healthcare system, the cost, reducing the cost in the system.
Digitalization,
yes. Absolutely.
At least in Regina Maria, the patient owns the data, so he can take the data.
Use the data.
He can use the data.
If he moves.
He can add the data,
Yeah,
so he can bring data.
In Telios also,
it's the same.
Yeah, it's the same. But what I think Şerban was trying to say that we don't communicate with another network. So
because it has to be integrated in a national system, in a big national
if
system.
they request it, yeah, of course, they can do it, but it's an effort for him.
Exactly, and the patient won't do this. Let's say
most of the time they will not know where they have their data. So some of them will have it on the medical family doctor.
Correct.
Some of them will have it maybe at Regina Maria if the employer gives them.
What we push is they have it on their phone. So because we all have smartphones, they have it on their app. So they can easily access their data and they can request, they can take pictures. It's really easy to get your data if you are a person that is concerned about that. Of course, if you are, let's say, not a technical person, you never know that that data exists.
Yes.
It's also fragmented. That's what
Şerban, yes, this is what
it's
I
fragmented.
think Şerban is saying.
It's a positive example. Otherwise, if we look at other entities, medical entities in the market in Romania, situation is quite different. And imagine not only in dental area, but also in diagnostic or cancer treatment. We have a patient starting his journey, clinical journey in a city in Romania, and then he's moving maybe to other city where the healthcare level is higher and they need those type of services, and is losing the initial data. And each patient going in the new site must take maybe another CT scan, another MR examination.
You have to start from the beginning.
Exactly.
Yes.
And it's also time consuming. It's somehow impacting the person. It's not nice to stay in an MR for 40 minutes. And in the end, it's generating extra cost. Yeah. Romanian healthcare system should be a kind of pyramid. Yeah. The first layer should be the family doctors, general practitioners, and they should be a filter. Yeah. Not letting all the simple cases to go higher in the pyramid, because as higher you go, as higher cost you are generating for the system, and also impacting the financial structure of the healthcare insurance. Yeah, absolutely. So the patient management, it's a must to have in our healthcare system. Each patient should actually get the right type of service and at the right level of cost for his own disease or case.
I wanted to make a small observation.
Please.
It's right what Şerban is saying. We need that filter everything, and so the private and the public sector to be integrated, and the patient has the best service they can find. But we also need to be very cautious how we put those filters, because if you look at UK or other countries in the West where they put too many filters, it's very difficult for a patient to go
to
access the services beyond those filters. The filters are so tough that you need to be really, really sick to access the next level. So that's not also normal, because
it's not accessible for the vulnerable.
When you look only at the
or
cost,
persons.
when you look only at the cost of the healthcare, those filters will become draconic. Yes. And it's not in the best interest of the patient. So we need to be very careful. I don't know when I say we, it's not me or Ionuț or Şerban or Oana.
Most of the people, yes.
All actors, and everybody should be aware of these risks. Otherwise, it will become a system which is not really oriented toward the interest of the patient, but most of those who put money in the system or who use those money from the system.
Conclusion is we need to keep the balance somewhere.
Yeah.
And the right term in some Western European countries, it's value-based healthcare. I mean, you actually produce a medical act that has the right value for the specific case.
And this is a good thing in Romania.
Yes, but we are
comparing
to go there. Yeah.
To other countries, yes.
So we still give more access to patients to different type of services, but without taking into account the impact on the healthcare system and the generated cost. Because also, it's not the equal type of measurement in the two areas, in the private sector and also in the public one. Yeah? In the private sector, the cost measurement is very tight. Yeah? Absolutely. Regina Maria has a very, very tight structure of cost, while in the public sector, it's more relaxed, I would say.
But Oana, for example, when a person is facing a, critical issue, illness, let's say it's cancer, what are his or her expectations when we talk about taking actions from the healthcare system? Because I think it's a difference between public and private sector, because our expectations are sometimes very different when we go to a public hospital. Otherwise, when we go to a private hospital, it's something else, because it's also the financial involvement here, and not only the financial involvement, but the care from the doctors and so on, and the facilities and much more than this.
Actually, this expectation, understanding the need, the specific need of the customer is one of our very close to our hearts topic. We have this approach of talking a lot with the customers, various formats of research, and being closer to the customer to understand actually very, very specifically the need, the expectation from how these needs should be covered. So on this topic, we have, as I said, run a lot of research discussions with the customers, and we have identified some areas of expectations. Some are, there is this separation actually between a specific expectation for critical illness. This is what we have recently found. Initially, we started with it's yet another illness. So we have a solution for, I would say, a rather broader range of illnesses, where actually the expectation is to have an alternative to choose where to get his or her treatment. So this is actually for hospitalization or with or without surgery. That's the main expectation, to have an alternative. Being public, can be public, but in here also there are some specific needs that people expect from an insurer to cover. If we are talking to private, it's about, of course, the cost, but it's also about the experience, how you access it, and also about a very specific aspect, the cash flow. If we manage to do this direct reimbursement with the medical networks like we have, it's one of our bigger partners for this health insurance, it's in the best interest of the customer. So having a hospitalization with a surgery or without surgery in a private hospital, if you just go and focus on your treatment and you take no care about the payments, so everything is done directly between us and Regina Maria, let's say, it's in the best interest, it fits well to what the customer expects, just to focus on the treatment and the financial part to be taken care. This is private. We can extend this based on customer expectation also with going abroad. Going abroad is usually related to critical illness. And in here we started slowly but surely to understand specifically the needs and what are actually people expecting in this kind of situation. We have managed to do last year a very extensive research just to come to some conclusions. And in here we have the following findings. It's about a very quick access to the latest treatment worldwide. So when we talk about critical illness, it's about I don't care what it takes, I need to be able to access the best treatment worldwide. This is one thing. The second, it's about the process. It's complicated anyway, even for some more regular critical medical conditions. But when we talk about critical illness, it's a very difficult, long, complicated process. So expectation, one of the key expectations is for somebody to take care of them end to end on this process. So it's about the process, it's about the medical bureaucracy. Another important finding is when this process starts. For us, it was a very important finding. People were telling us that actually this critical illness journey does not start when the treatment starts. It starts way, way earlier. It starts with the first suspicion. This is the moment where actually the world stops and you start asking, and now what should I do? And actually this was a very, very important finding that we pinpoint and acted upon, that expectation is to be there, close to the customer, both with the process, what to answer to this question. What should I do now? Where should I go? What kind of doctor do I need to do? What kind of investigation do I need to take in order to have a diagnosis? This again was important, and last but not least, again, the financial burden, especially when we are talking about critical illnesses, and as I said, associated usually with the need to go abroad in order to access the latest technology. Yes. And so on. And also is this latest, it's what it's called precision medicine, personalized medicine dedicated to rare cancer. This is something that people would like to have as an alternative in case they face this situation, and it comes with a very, very high cost. So this being the expectation, actually what we did, as I said, because we sit, we listen, we understand, and then we act upon, we launched this dedicated health insurance called Premium Care Abroad, with an insured amount of more than 2 million euros, covering the main critical illness, treatment abroad, but not only treatment, it starts from the first suspicion with diagnosis in Romania. So expectations, I think if we sit and listen to what customers are saying, they come together. So it's not only about financially granting them some indemnity, it's about understanding some other specific need. And this about the process appeared quite a lot lately, and the need to have somebody close to them to run through this process.
Ciprian, how can telemedicine contribute in increasing employee retention in our country? Because, you know, we all know that this was a problem, and it's still a problem in Romania.
So we work with a lot of companies, and also we work with insurers and other providers or partners like NN. And we saw that especially employers, they are keen to have a workforce which is healthier, because this way they will come to work. If they are sick, they will stay home or go to a hospital or somewhere. So we can at least help them at the beginning to have a discussion with the doctor or the specialist. Also, we can help them have a preemptive behavior, like you don't have to be really sick or to feel unwell to discuss with the doctor or the specialist. We have also well-being specialties like psychology or nutrition or fitness, and you can take measures to maintain your level of health. And if something happens, then you'll discuss with the specialist. You don't have to lose time in traffic, wherever, or waiting for a consultation. And if really it's necessary, you'll get a referral from our doctor, and you'll use that referral to go to a clinic in person. And after you do your, let's say, the consultation, or you go to the medical clinic and really let the doctor put his hands or her hands on you, maybe they will recommend you blood test or whatever. Then you can come back to us, to the same doctor, and ask opinion about that, and the doctor will tell you if there needs to be anything done more. And as I said, 80% of the cases, people will not have to go to a in-person consultation.
So this is the main advantage for employees.
Advantage, and for an employer, it's cost reduction. Also, it helps him give to his employee a solution which is very convenient, and in time they will build a behavior that will reward them to use medical services. And if they maintain their health, of course, they'll be more available to do work and to come to an office or do from hybrid work or whatever, but they will be available somewhere and they will work for that employer. So for an employer, it's important. And also for an employer, using telemedicine together with insurance maybe will help them to have better negotiation with the insurer next year, because using telemedicine will lower the losses on the insurance. So next year, if your employees use telemedicine services, your cost will be lower on the insurance. So it will be easier to renew the policy and go forward. So I think there are many advantages for an employer to use telemedicine, also to retain their employees. Because I want to mention also, I think another aspect important is that this convenience goes to a high satisfaction rate. We have 4.7 out of 5 satisfaction rate, and it's important to maintain this satisfaction rate very high for the employees, and that will go also for the benefit they get from their employer. And maybe they will stay longer with the same employer, maybe they will be more keen to work with that employer and continue the relationship.
Ionuț, Leahu, how does the whole experience now going to the dentist today, how it is? Because as I said before, things evolved in a good way for the patient. I think it's a better experience now than it was, I don't know, 5, 10, 20 years ago, going to the dentist.
I think the main change now is that we are switching from person-to-person care, because going to the dentist was going to one dentist and having a relationship with one person. So you are stuck with his schedule, you are stuck with his abilities, and to refer you out of his practice was rare. So if you had a more complicated thing, maybe you wouldn't get the right solution or any solution. So now we are switching to the institution relations. So finally dentistry has matured. So now we are thinking, okay, you have a relationship with an institution. The institution has, let's say, it needs to provide you with the right specialist throughout your lifetime and also for your family, because you want to take care of your children, you want to take care of your parents. So it's about that, because with the institution you get grades and you get NPS scores. So we look a lot on the experience of the patient, because our focus was always, okay, we need to do the right job in the office, but we don't need to forget the patient, that he's also a human. So we need to take care about his feelings, about, we are not talking about pain anymore for at least for the last 15 years, we are not talking about pain anymore in dentistry, but now we are talking like waiting time, like receiving the right care, getting to the right specialist, because also with dentistry, it's not only one doctor now, we have like 8 specialties in dentistry, so it became a bit more complicated to find the best solution, because you can go to a general dentist that can do your extraction, can do your implant, bone grafting, crowns, whitening, braces, but you cannot do everything right. And also, me as a doctor, I don't like to do everything in dentistry. So, for example, I like to strategize the treatment plan, me personally, and to place implants in the most severe cases. So this is my joy. So I want to bring my joy to the patient. So in case I see the patient needs another doctor's joy, I bring that joy to the patient. And this is the fundamental change. And also because, again, you as a patient, you are a lifetime patient, because you need to have that continuity. But of course, me as a person, eventually I'll retire, maybe I'll move out of Romania, maybe things happen, because a lot of people, they will say, yeah, but I've got my dentist. But your dentist will eventually not be your dentist anymore,
like forever.
Because it's not a forever relationship. But this is what we realized, and why we pushed to develop this network and to join Regina Maria, was to create the first true institution in dentistry. So this is, I think, the biggest step is to create that relationship.
But what's the impact of technology in this whole experience?
First of all, we are talking about the digital file. So you have all your data,
as you said
and
before,
perpetuity.
Yes.
And we have all the treatment plans that we ever did, everything that we discussed, everything, the data is there. And then what we do with the data is really important, because now, for example, we are starting to work with predictive medicine. So we know that, again, we're talking about diabetes. If you have diabetes, I am sure that you need the special care. So we are going to contact you out of care. So because you are our patient, we care about you, you have diabetes, it's better you come and see a specialist in perio disease, because we know statistics link these two together. And also when we manufacture teeth, because now when you come to get a crown done, maybe all of us received at least one crown to be done on our teeth. And the usual experience was free trips to the dentist, at least. We're talking about traffic. Sadly, we cannot do crowns through telemedicine. So
not yet.
we need to
do it with a drone or something.
The drone, and it's not the crown, the drone. And now we have, for a couple of years, we have been working with technology. We do digital scanning, so we don't use that putty to take the impression. And because we are using digital scanning, we have a special software that we have been using AI in dentistry for a lot of time, because when you are missing one tooth here, we scan the whole mouth, and then the software will recreate that crown. It's called biomimetic. So it will try to understand how your teeth are, and it will propose the shape of the crown that you need there. And then the doctor just touches a bit the crown to finalize the design, and then we send that information. It's a machine like this, it's a robot, that you feed a little block of ceramic, and the robot will grind away everything until you receive your crown that gets put to use in the same session. So one visit dentistry, it's what we've been dreaming about. I don't know if you as patients are dreaming about that. So I think this is the main practical that you get to experience, and you feel it, and it's really funny, because when we started to roll out this technology, everyone was, wow, shocked, surprised, but now it's something that they take for granted. So the patient now,
something common.
Yeah, now the patient expects to be treated like this, because we managed to push and to educate the market to, okay, this is the normal. And this is actually what we are doing. We are constantly pushing the industry. We're creating, this is the norm. This is not performance. This is the things that we should all do for
daily steps. Yeah. But Ciprian, I want to come back to you, because you were explaining us about the telemedicine and employees. Do you have a feedback from employers, or maybe from employees, when you give your services to some companies? What is the feedback about this telemedicine program?
We collect data about their ratings to the doctors and how they feel about using telemedicine, how we help them. So we score those rates, and we try to also adapt our services based on what they are saying. Like Oana said, like they are also trying to do that on insurance, and I'm sure Ionuț is doing the same stuff. So we are very attentive to what they are saying and what they need actually, and most of them tell us that they really appreciate the convenience, the fact that they can access it very, very quickly. Like if you give us a call, you'll talk with the doctor in 15 minutes, which is very, very fast. And we cover 28 medical specialties, so we do a lot of effort to increase this level of not only satisfaction, but the speed on which you get a medical response. at the end of the consultation, you'll get a referral. So you'll go maybe to Ionuț and treat you, and he will treat you if you need that. Maybe, but in some cases, maybe you don't need to go there. But at least you have an answer. A medical professional will give you an answer, and you know what needs to be done. And if you need a treatment, also we can offer you a prescription with a digital signature, which is valid anywhere in European Union, so you can go. And we went a step forward. We made partnerships with the biggest pharmacy networks in Romania. So now you can you can choose the pharmacy which is closer to you, and you send the prescription directly to the pharmacist. He will see what you need, and will give you back a message saying, yeah, come and take it. Don't come, search in another place and find the medicine you need. So the feedback we get is that it's very convenient, it's very fast. The doctors are trained to reply to you in a digital matter, in a digital communication method, because it's different than the way you communicate when you're with a patient in a physical location. And you need to be more specific, more clear in what you communicate. Also empathic. You always need to be empathic, but sometimes doctors forget that.
Now it's the future. Digital empathy.
Yeah, digital empathy right now, especially if you don't get to see his or her face.
You have to be more empathic.
You have to be more empathic, and also you need to
communicate better.
To communicate better and be clear and give all the data the client needs right away, and in those 15 minutes he will know what to do, and he will have the answer. Especially when you communicate with the parents, for example, and they call you at 2 o'clock in the morning with a child with fever or something, and they don't know what to do. Should I go to a clinic? Should I lose time or go in winter with him outside if he's having a fever? And the doctor will give you this answer. So the feedback is really good. People are used to use right now the services. We constructed a journey that is very easy to access. So anybody, we don't need to have a PhD in IT to use our platform or something. And the fact that you just call or write and you get an answer in less than an hour, it's great for them, and everybody's saying the same thing.
Şerban, how can we explain to, a simple and average citizen the most important benefit or the whole benefits from implementing technology in the healthcare system? Because it's in their benefit. It's not only for doctors or for the healthcare system, it's in the benefit for all of us.
Technology, it's a layer somewhere in between. So it's not maybe directly visible to the end patient. But listening to the stories, it's very clear that we slowly but clearly start to put the patient in the center of the healthcare discussions and healthcare system. And the benefits are obvious. It's not only technology. All the other aspects discussed here, the clinical area, insurance, the IT part. Technology, it's that part of the chain which is actually improving patients' life from several perspectives. First of all, technology can be brought or implemented at the hospital level, in the local community, even in a simple village, at a specific level. And this is also supporting each patient to receive a type of healthcare in the area where he is physically present. Of course, telemedicine is supporting the case if needed to be accessed remotely. But again, technology here, it's creating also a big amount of data, clinical data. Clinical data can also be used for future trends in order to do a better planning for the patient needs. We talk about a lot of data, like in Regina Maria. We are collecting data from different clinical segments for each patient, and having an AI engine behind, we can also predict potential future diseases. This information can also reach insurance. They can also do their planning, also in IT. In the end, the patient should be safer from the perspective of having a quicker access to healthcare, again, at the right level of cost. Technology, for example, We are working, of course, with Regina Maria in different clinical segments in cardiovascular, interventional imaging, ultrasound, and we have top technology equipment. What is also important here, the users actually are using the technology in order to provide to the customers, their customers, the patients, the right diagnostic, very accurate, and the proper treatment in the end.
You gave us one example of the new technology that's right now the normal thing in dentistry. But what is the trend and what are the, I don't know, other innovations? Because I think that the patients and the, as I said before, every citizen is very curious what's happening in the future with this sector, stomatology.
I think we are pushing more for prevention care. And
so this is the trend, the main trend.
The main trend is to help you keep your teeth as long as possible. Mm-hmm. And when we are looking about that, how can you lose the teeth? Because we need to think about the problem.
Understand the process.
Understand the process. We need to understand the problem. So we are all going to lose a tooth or all our teeth out of two reasons. First is the mechanical reason. So if your bite is not correct, if your teeth are not aligned, then you are going to lose faster. And of course, we have the biological problem that comes from the periodontitis and from the decay of the teeth. This is the problem. Now, how can we address that? So first of all, we are looking at what's happening in other countries. For example, in Holland, what's going on is that 80% of the children have braces. So this is the norm there. In Romania, we are now starting to see, but still in Romania, we have a lot of adults.
Adults, yes.
And for an adult to have regular braces might be an issue because it's hard to eat, it's not so pretty, sometimes the wire sticks you somewhere, and that's why we are using again, a couple of years, we are using a technology in which, again, digitally, we scan, and then there is a software where you digitally plan the movement of your teeth, and then you have a machine that produces plastic covers that you wear at home, and you can manage it by yourself. And it's really fun because this is teledentistry, because teledentistry means, okay, of course, we need to see you, to scan you, to plan you, but then you go abroad and we send you by mail. We are sending you by mail the special plastic covers that you are going to wear by yourself, and then we can keep in touch digitally. So you send us a picture, we see, okay, everything is going on, and we maintain our digital connection. And for adults, it's really important now to have access to this type of technology, because this is a common topic, and we're getting back to the institution, because you need to be an institution to have the ortho specialist readily available, because what will usually happen, this is the most, I think, from my experience, is the most misdiagnosed problem, the bite problem. Because usually there are preconceptions in which the patient receives the information, yeah, but it's your charm,
yes.
This is you, so we don't need to fix it, or at your age.
It was the old approach,
yeah.
yes.
But it's still common, so I'm still seeing patients, and I mean patients who have my dentist. So they have my dentist, they've been treated for 20 years for the consequences of a bad bite, yes. But then I told, but have you spoken with the ortho specialist? And yeah, I asked about an ortho specialist, but they told me, my dentist told me that I don't need it. So, you know, this is, you need to have, like, we are talking about the patient journey. And the patient journey, you know, at least in Romania for adults, we didn't have the orthodontics available until I don't know, for the last 10 years now.
Something new.
It's common, you know, to have an ortho tell you, okay, we need to use braces. And still, if we talk about braces, about 85% of the braces are still classic with wires and metal things. And still there is a big generation of doctors, and not only in Romania, in Europe, that still believe that the old school is better. So now, as an institution, we can get involved into that, and we can attract the right specialists, the young doctors, we can train them, we can put technology in their hands, And then we tell, okay, let's go in the now. I mean, let's offer the patient the option. Of course, if the patient thinks it's cool to have braces, we use braces. But it's only the cool side of the technology. So with Invisalign and Spark and a lot of aligners nowadays, it's even faster and it's safer for the patient to go through that treatment. And also I saw the effects of that treatment at home. So my wife used the liners and I could follow up the case day by day, and it's really a great technology.
Oana, in your field in insurance, the same question about innovation and digitalization. How can this improve the health insurance system?
Yeah, innovation and digitalization, as obvious as it seems, but it's quite, they are both quite close to our day-to-day, I would say, job. As Şerban was mentioning, this is actually under this umbrella that we call customer-centric approach. So this is where everything starts, and it comes to get some sense. We have a lot of, because as Şerban was mentioning, there is a lot of data crunching, analytics, advanced analytics and so on to do this, the financial modeling part of the insurance. So it's a lot of this on a day-to-day basis. But also it's important in terms of innovation. One area very close to our heart is not only about this big data, it's also about sort of small data, listening to the customer, understanding. As Ciprian was mentioning, it's not only the telemedicine. We have seen this as part of all the reports that we have, global trends in Romania starting appearing. It's not something completely new. So sometimes we wonder for a few years, how should we tackle this? Is it something that we need to add or not? Actually coming closer and using, besides the big data, this so-called small data, it's quite important, understanding what is the need. This customer called it medical care at hand. 24/7, everywhere, can I have a prescription, this kind of needs. It's coming usually from this kind of small data complementing the big data. So we see a lot in this innovation, all heading towards what we do constantly, looking to improve our portfolio of solutions. So as I said, once we see a trend and we have this ambition to be ahead of market and of trends, to understand quickly and to act upon in order to come with a solution. And this is what we usually do. We have seen this in critical illnesses. We have come with this dedicated insurance. We have seen and finally understood what is needed in telemedicine. We have run last year an RFP, quickly organized, and we partnered with Telios Care, and we offer this for all our insured person in Asigurări de Sănătate NN. So acting quickly, this is what we call innovation, understanding quickly big data, small data, and acting. Digital is another part, quite important. We have this ambition and a lot of effort through the last years. It's quite important from this aspect that we discussed earlier about bringing insurance closer to people. Insurance is complicated. If you stay and try to analyze everything, we must be honest, it's complicated. So digital, it's a way to help to get it more accessible, at least from the process point of view, from understanding what actually you have. So we have, for example, our digital app, NN Direct, where you can see exactly what is my product, so what my coverages are. For surgery, I have this amount. For this, I have I can do the payments. So these elements, both from the product side and also from process part, how do I do the payments? It's another payment that I need to do, another burden, so on. When I have a claim, can I use this digital app in order to ease the process, especially if it's an easy one, like I have gave birth I have gave birth. That's quite a simple case. I need to put medical documents and birth certificate. That's an easy one, can be digitized, let's. So these are the areas where we look very closely and we put a lot of effort to quickly understand and act upon so that the customer can actually see the benefits.
Şerban, you said some of your solutions or technologies that are also now implemented, but please give us, I don't know, more examples of what are you doing right now for the healthcare care system?
If we talk about innovation, Philips has a tradition more than 130 years of continuous innovation. Currently, we are developing, having in mind the patient, but also the users, clinical users, all our solutions in all the business segments, because we are present in diagnostic, treatment, home care, hospital care, IT. Everything is designed from the beginning, having in mind those two objectives: user, clinical user, and also patient. As new solutions for the market, we have numerous, but I would like to mention, for example, one MRI system, magnetic resonance. It's maybe the most attractive type of scanning for the population. They believe that if I'm taking an MR, I will be healthy afterwards. No. People should understand that the MRI is the most expensive for the system
it
type of
examination. With the back pain, actually.
Exactly. Those machines are using something which is not actually forever available on planet Earth, which is liquid helium. It's a special gas, and they are using a lot. Each machine has like 1,000, 2,000 liters. It costs a fortune, like a more expensive car. And 6 years ago, we introduced one machine which is using only 7 liters. 7 liters, and those 7 liters are never consumed. So it's a kind of lifetime perpetuum mobile type of machine, which is providing accurate diagnostic for the patients. Besides this, in many other fields, in ultrasound, for example, echocardiology, we have developed the real life for the ultrasound. I mean, today it's a golden standard for all radiologists. Regina Maria, for example, is using this as one of the first customers in Romania, and the list can continue.
Ciprian, also more or less the same question: how Telios Care facilitates quick access to medical services for people, for employees especially?
We we designed a journey for the client, which starts with as far as I know, we are the only medical clinic in Romania who offers a call center which is run with nurses. So from the first time you call, you discuss with the medical professional. They will do an anamnesis or a short diagnosis, and then we'll direct you to the right specialist. Then we try to build services which respond to many needs. Like we have 28 specialties we cover right now. Some of them are preemptive, as I said, because doing preventive medicine, it's much cheaper than to do a treatment. And I hope I'm not going to lose my teeth. As you said.
We need to talk.
Yeah. You see something?
What stomatology will look like in the future? Because yes, I think this is one of the main concerns of all of us. We are going to lose our teeth. Okay, but how will it look like? The system
somehow works. Because we are talking about a lot of about insurance. Insurance is really great. Is really great once you lost your teeth.
We started from the prevention, so we have in our prevention packs included in Asigurări de Sănătate NN. We have the stomatology from Dr. Leahu. But it's just the first step. I took the message that it's just the very first step. We need to think about the moment where we for sure lose our teeth.
So another model in medicine in general has been now for more than 35 years, the subscription model, because we want to stay in shape. We get a subscription to the gym, but why not a subscription for your teeth? And that might cover the prevention side. So we can work together, because covering prevention and then covering treatment, and especially more severe treatments, because we are talking about that special kind of cases. But we get special kind of cases, and again, the gap, the amount of money that the patient has to pay to receive a normal life again, it's getting higher and higher because you have this gap. You know, you have someone who for the last 20 or 30 or 40 years didn't receive the right care, and then or didn't invest enough. So, and I give this example to the patients because sometimes the patient says, "Oh my God, it's a new car," and I tell them, "Yeah, but the new car, you leave it parked in front of your house or your office. You don't go to sleep with your car, but with your teeth, you want to go to sleep with your teeth in your mouth." Because the same will happen, for example, if we all here stop paying our taxes for 10 years, eventually we'll get a huge amount to pay after 10 years. So this is what I see a lot with patients, and the patients, you know, sometimes they lose this touch with their own self. Because it's a study that we've been doing for 6 years now. We're entering the 7th year of data, and we know that half of the Romanians don't go to the dentist, and 1/3 of the families in Romania don't go with their children to the dentist.
And don't use also the toothpaste and so on.
And toothbrush.
Maybe they
much
don't
more
have.
complicated. Not only.
But you know what's really interesting? It's really interesting because we were talking in the beginning about perception. Because this is the issue with teeth also. Because when we ask, okay, why don't you go to the dentist? And they say, no, the main reason, so because it might hurt, it's number 4 or 5. Mm-hmm. So the first reason is I don't have any issues with my teeth. So having no issue means I don't have to go. Yes. So we need to change, because I think we as a healthcare industry, we need to push this type of prevention. So this type of prevention in which we need to bring more the patient before he gets sick, not after.
And we reach to the closing remarks. And Oana, what key trends have shaped the health insurance industry in the past years, and what will happen in the future? It's very important to understand what we have to expect and what should we expect in the next years.
In the last year, we have seen one key line, which is again linked to this customer-centric. The customer having this need to be understood and receive a sort of personalized, specific, and very transparent, easy to understand solution. So this is actually one of the key lines that we have seen over the last year in insurance. For this, actually what we discussed, we listened a lot, we understood what are the needs in order to come with some solutions. If we are to look to the future, there is linked also with this longevity topic that it's raising more and more. There is this very I would say growing need for improving the control of financials over the future. So this is the key for the next. In Romania, there is a specific situation, a bit strange, where the biggest challenge is actually also the biggest opportunity to grow. And this comes again from the topic that we touched before, which is protection gap. But for here, there are, in order to tackle a bit the growth, there are 4 areas where we focus. First is education, a lot of education, financial education, understanding what is doing what, how insurance can help, what is the protection gap, and what solutions are on the table. Second is about innovation, a lot of innovation, as I said, because we need to break a bit the topic in pieces and to get it closer to the customer, both from solution side and also processes. Third, not necessarily in this order, it's about managing fast to come with solutions once we understand what the customer needs. So concrete solution, and to push it and to just get it closer to customers. And not least at all, we have seen in Europe an important element that helped growing this protection part, which is the fiscal benefits. In Romania, there are some fiscal benefits regarding health insurances. I wouldn't say are good or bad. I would say just that there is room for improvement. There is, as we speak, some legislative initiatives to increase this level. There is proven cases all over Europe. This kind of initiative in the legislative support part have increased significantly the uptake. And we have quite high hopes for this. So a lot of focus, innovation, digitalization. Actually, we aim to be the digital insurer of the future, very much putting all the effort and energy and investment behind this. Of course, controlling, because that's the baseline of whatever we do, having a sort of financial stability, both from us in order to grant for our customer. So this, I would say, it's from the past to the looking to the future, our position.
Şerban, which areas from the medicine, from Romanian medicine, need urgent intervention from, I don't know, technology, innovation, digitalization?
I would see here a major need for such investments in digital area, but also in sustainability. In digital area, as we've been discussing throughout the talk here, this has to be implemented everywhere in the country, in both public and private. We are in good contact with authorities. I'm referring to public authorities, in order to convince them about the benefits of going digital. Yeah. Going digital, doesn't make sense to continue the story about the benefits. It's huge, and it's also supporting the national healthcare system to keep the cost under control. Yeah. It's very important to know in 5 years from now what will be the cost level of the public healthcare in Romania. Any private business is taking care of that. Regina Maria, for example, knows each penny where it goes, and every minute. Sustainability. All the investments should be done in a sustainable way. What does it mean? All the investments must be seen as end-to-end, as having or not bigger or smaller impact on the energy consumption, on the waste generation. Waste generation, for example, the healthcare industry is generating 4% of the global pollution. 4%. It's in the top of most polluting countries, it's number 5, if it would be a specific country. And here, what are the reasons? Production of medical equipment, transportation of medical equipment, the whole chain. Also bringing the medical devices into a country, using them for 10 years, and then not having a recycling process behind. So all this have to be corrected. Investments which are done now will pay back in the future. I mean, the idea is to have a healthy planet, in the future, with healthy generations of citizens.
True. Healthy generations of citizens, and we need to talk, I think, a little bit more about oral health, and to educate the main audience from Romania. And the main audience, it's not us, I think it's other type of people. How can your sector can address more to these people in the future? Because I think that stomatology needs to make more steps to the public,
there is
the
only
patients.
one way. That one way is One Health, and meaning you go not to the dentist, you go to your cardiologist, to your diabetologist, and those type of doctors tell you, okay, when did you go to the dentist last time? So if we start to look at oral health as belonging to the patient and now not to the dentistry industry, then we realize that we as a whole healthcare sector, we all need to talk about this missing link in healthcare. So we need to address this as a community, and One Health will be able to do that. And I'm really happy that in Regina Maria, I'm talking with 3,800 other doctors that are not dentists. So, for example, if you are pregnant, in the first semester, your gynecologist will send you to the dentist. So this is the type of approach that I think it's going to bring change, because I've told you about the study. That study was, okay, we're educating the market, but let's see what's changing in the market. I mean, what's changing in the way that Romanians use dentistry. And I've seen that the change is really slow. So we needed to change our approach. So this is the approach that we came out with, the One Health approach, and to bring all the resources of the healthcare sector in Romania to cover this missing link.
And Ciprian, how can telemedicine help and reduce also absenteeism and help the employees on long term?
I will take it from where he left it. Like we need to look at what the people needs and what we data we get from the way they behave, and also we educate this market. And educating this market, we also look ahead of what we should bring next. And there are certain services we can think about, like more functions to analyze data at home or gather data, medical data at home, or using medical devices, portable medical devices, or providing home care. And we have a discussion with the insurer about that. So as we educate this market, we also overcome some preconceptions people have about the way they access medical services. For example, I saw a study where 72% of people on average in Romania, they were thinking they have a good level of health, but 65% of them were more afraid of losing their job than to lose their health, which is like a gap in the right perception, you know? Like health is more important than the job, because you always can get a new job, but you'll never have the same level of health. So, and in the same time, the statistics show that 1 in 4 Romanians suffer from a chronic disease. So the gap between perception and reality is very big in Romania, and we need to help these people to become more realistic about what they should do. And this is what we are trying to do at Telios, and also I think everybody at this table. We try to educate the market and make people more aware of what's there out there for them, how they can access services faster, better, with the right specialist, and where they should go when they have a real problem. As you said about employees, yes, employees are much faster in adopting these new trends, because the employer gives them the benefit, why not using it? So they overcome a barrier of cost at the beginning, and they become accustomed to use services like that. And if at some point in the future, maybe somebody in their close family will need medical services, they will know what to tell them, how they can access those services, maybe by an insurer, maybe by a subscription, maybe find the right employer and negotiate when you go to a new employer to have this kind of benefits included in your benefit scheme, which is important. And Oana said about fiscal advantages. Yes, there are. You have 400 euros per year. You can deduct from your taxes to access medical and insurance services. So private health insurance. So if we bring more services, we cover more needs. And we educate this market, in the future, people will be healthier, live longer, and be more satisfied, and also the employees, employers, and everybody.
Yes, true. Thank you so much for being in this discussion together, and I think it's only the good start of a healthcare system, and about care and about well-being and what's going to happen in Romania in the future. Thank you so much for being with us at NRCC TV. See you at the next episode.